Building your legacy, to me, it means creating something, developing something that lasts longer and is bigger than myself.
Creating something that puts out a positive impact to others around you in your community, and even when you're done participating in that said event, that still lives on.
I really want to make my family proud and myself proud, and I want to feel accomplished, and I really want to impact my community and just help other people. And I want to represent the School of Pharmacy well.
I want to be able to treat different patients or help them manage their diabetes, help them manage their hypertension, help them manage their dyslipidemia. I want to focus on the maintenance of chronic health conditions and how we can stabilize it and, eventually maybe taper patients off some of their medications if we can get them at a point that their health has improved and been maintained for a while.
Personally, I want to pursue a residency after I graduate, and I want to work in a hospital. They have different roles in the hospital. You have central pharmacists and you have the clinical pharmacists that work on the floor. And then you also can branch out into management. And eventually that's kind of my goal, is to work up into hospital management.
I see myself in some sort of postgraduate training, whether that be a residency or an industry fellowship. And I think our school's done a great job of preparing us for whatever that route might be post-graduation.
It changed my life. Every young person has to figure out what their skills and capabilities are, what turns their light switch on, what wakes them up in the morning. But for me, it has provided lifelong learning. You never stop. You grow in whatever role you're in.
How do I influence healthcare for the state of Mississippi? How do I make our clinics and our hospital services more accessible to patients? And how do we improve the care that patients are receiving at our clinics and at our hospitals? And so being able to build that legacy is really just making these small everyday improvements that lead to a much more global improvement. And that's something that's going to well outlast myself or even my team here at UMMC.
We've got a program at the national level called Flip the Pharmacy, and over a period of a year, it teaches people how to change their practice model from that reactive to a proactive business model. I'm honored to go across the nation and teach other pharmacies on how to do this program. That's the legacy I have built, and any student at a pharmacy school that has a goal of owning their own pharmacy, they can do it. They cannot hang a sign on the door and say Bob's Pharmacy and expect people just to flood in, They've got to do something different. They've got to get involved with their patients, get involved with the medical community, and let the patients know that you're here to take care of them.
I hope that my legacy is I wasn't the same, but what I did honored my role as a pharmacist and as a woman. Invest in yourself, but invest in others. And if you do both of those things, you can have just an amazing career in life.